Hi, this video is the demonstration of the FUE donor scar, 1 year follow-up. And the scar is around here, we scatter throughout the back. And the FUE produce tiny dots of scar scattered through the back and allow you to wear your hair shorter. So the FUE scar is less visible, where the FUT will have the linear scar, and the linear scar you cannot wear your hair shorter. So the FUE is not just less scar. The benefit of FUE are we're not cutting you open. That means less invasive, less bleeding, less chance infection, less painful, and recover faster. So you heal faster and less side effect. But the downside of the FUE are more expensive. The number of grafts we can do is less, 2,500 to 3,000 per day max. But a year later we can do more. Versus the FUT, you can go 4, 5, 6,000 grafts per day. The other important about the FUE downside, not just the price and the number of grafts, but the growth rate. Now, you can have good result with FUE and FUT. You can see my work is very dense. But if you compare my FUE to my FUT, yeah, the FUE is around 5% less. On the other hand, the FUT has the pro and con. The FUT is the one that leaves a linear scar. It's more antiquated, more invasive than the FUE, because the FUT will have to cut you open and suture you up. That means more painful, more bleeding, more chance of infection. It takes longer to heal, and you can have the permanent linear scar and permanent numbness along the linear scar for the rest of your life. But the good part of the FUT is more, it's cheaper. You can do more graft per day. You can transplant up to 5,000 to 6,000 grafts per day, depend. And versus FUE 2,500 to 3,000. And then the other good part of the FUT are the growth rate is 5% better. So this is the demonstration of FUE, no surgery without scar.